My name is Shariff Bishai. I am an orthopedic surgeon, sports medicine fellowship trained, and I specialize in shoulder and sports medicine. Being a surgeon is obviously very stressful at times, so one of the things I really love doing is golfing. It's something I can do as I get older and stay competitive, and it's part of my identity. And unfortunately, several years ago, I injured my shoulder. Something that most people don't really talk about is pain changes your personality, because pain can cause you to be not who you want to be. And so I know that it was hard on my family. It was difficult for me. It was hard on my patients because I wasn't my best self. I had a rotator cuff repair, and I was lucky enough to get Exparel prior to surgery. And in doing so, that helped me post-operatively with very little pain. And so it was great for me, but it also helped me realize what I wanted to do for my patients. My family and I played golf every Sunday night, and unfortunately, by having this shoulder pain, I couldn't do it. So being able to get back to that was a very important aspect in my life. One of the hardest things for me to see is a patient in pain. And one of the concerns for patients is that the surgery that I offer them will lead to even more pain. So it's important to me to make sure that we reduce the post-op pain for them. And we've noticed that with non-opioid alternatives such as Exparel and a multimodal approach, these patients are much easier to take care of post-operatively because they're just not having as much pain. They leave the hospital that day. They come to the office the next day. We start their therapy essentially immediately. These patients are comfortable, they're smiling, they're ready to move on with their recovery versus coming in saying that they're in excruciating pain. This is my Exparel story. I encourage you to share yours.
Indication and important safety information. Exparel is a one-time injection into a surgical area in patients 6 years or older to reduce pain after surgery, and in adults as a shoulder nerve block and leg blocks to reduce pain in a specific part of the body. Safety and efficacy in other nerve blocks are not established. Exparel may cause a serious condition where too little oxygen is delivered to blood cells. Get immediate medical attention if you experience pale, gray, or blue-colored skin, headache, rapid heart rate, shortness of breath, lightheadedness, or fatigue. Temporary loss of sensation or motor activity that may last up to 5 days can occur. In adults, the most common side effects are nausea, fever, constipation, headache, and vomiting. In children, the most common side effects are nausea, vomiting, constipation, low blood pressure, low number of red blood cells, muscle twitching, blurred vision, itching, and rapid heartbeat. Tell your doctor if you or your child has liver disease, since this may affect how the drug is eliminated from the body. Please see full prescribing information at exparel.com/prescribing-information.pdf.